Good evening. In the past few days, 2 children have died of dengue, and one of the factors that is seen behind these 2 tragic deaths is the fact that they went to several hospitals, in one case even to a government hospital, and yet they were turned away. 2 children dying because of that. After this, today the health minister has read out the riot act. After sending notices, today the health minister has that nobody, no hospital, even if you don't have hospital beds, can you turn away someone who comes to you for help. Now, so on agenda, we're coming to you from All India Institute of Medical Sciences, their trauma center. It is the best institute, but can things go wrong anywhere? And how bad is the situation? We have doctors. We also have lots of people from the other side who have experienced the system. We are going to speak to them. Lots of people who have tried to come help for dengue. What kind of problems are they facing? And even if you are not in Delhi, for you, what we have are what kind of recourse can you take? If you're turned away from a hospital, what can you do? Who do you go to? First of all, let's just hear what the health minister said today while he was telling hospitals how to act.
10,000 बेड दिल्ली गवर्नमेंट के पास हैं, 20,000 बेड एमसीडी और सेंट्रल गवर्नमेंट के पास हैं, दोनों के पास 10-10 हैं, और 20,000 प्राइवेट के पास हैं। टोटल दिल्ली के अंदर लगभग 50,000 बेड बनते हैं। उनको आदेश दिया गया है कि कोई भी एडमिशन के लिए सीरियस पेशेंट को मना नहीं कर सकता है, और अगर उनके पास फैसिलिटीज नहीं है या बेड नहीं है तो उसको स्टेबलाइज करेंगे। स्टेबलाइज करने के बाद ही दूसरे अस्पताल में भेज सकते हैं। मतलब NS1 एंटीजन का 600 रुपए ले सकते हैं, और डेंगू एंटीबॉडी का 600 रुपए ले सकते हैं, और प्लेटलेट काउंट्स का 50 रुपए ले सकते हैं। ये हमने रेट पे किया सभी हॉस्पिटल, सभी डिस्पेंसरीज के लिए। एक टेस्ट दिल्ली गवर्नमेंट करती है जो कंबाइंड होता है, वो फ्री में होता है, और जिसने फ्री में कराना हो दिल्ली गवर्नमेंट के किसी भी अस्पताल में जाके फ्री में करा सकते हैं।
So very clear instructions, but are they going to be applicable? And if these hospitals don't toe the line, what happens to them? Let me just introduce our panel this evening. We have Dr. Vivek Nangia from Fortis Hospital. He will give us the private hospital's perspective. Dr. M.S. Sharma over here. Dr. D.K. Sharma. He is from All India Institute of Medical Sciences, giving us their perspective. Also, we have Puneet Mittal, lawyer who's dealt with lots of medical negligence cases, and Shishir Chand. They're from People for Better Treatment. It's a group that has come together of patients who want justice for medical negligence. Now, before we ask Dr. Vinod Pal, also of AIMS. Now, I just wanted to, before we ask all the doctors and the other side as well, let's just give you an instance of how bad things can be. We have someone here over here who came yesterday to get their friend for potential dengue. They came to All India Institute of Medical Sciences. And then, Jyoti, when you came over here, what happened?
When we reached here at around 8 o'clock that night, they asked us to first take the stretcher, otherwise they will not admit the patient at the emergency ward. Then I and my warden ma'am took the patient in the stretcher, and then after completing all the legalities, they started operating her. But my question is that without the legalities, can't they operate?
How long did the legalities take?
Ma'am, it took around half an hour, almost half an hour, and she was shivering out of pain, and she was crying out of pain.
And you all came from the hostel?
Yes,
you're all students? Yeah.
Yes,
and then?
And actually we are not allowed to leave our hostel at after 6:30, but still she was not well, so we took her to the hospital. So my question is basically, what is medical negligence? Our doctors
after that, was everything okay?
Yes, ma'am. After that.
So Dr. Sharma, here the patients themselves are being asked to bring stretchers out, and this is in, obviously we know things are bad, but this is in the best hospital in the country. Would you say this is the normal way to go about things?
Well, once a patient comes to the hospital, a patient has to be examined by a doctor, and naturally a doctor cannot examine the patient while he is standing. So the patient has to come in a stretcher, and stretchers are available outside the emergency only.
So the patient
has to get down and be lying on the stretcher and then come inside. How will the doctor examine otherwise?
But it's the patient's responsibility or their attendant's responsibility to get the stretcher themselves. It's not, the hospital staff that can do that.
hospital staff is there near the stretchers. But then the patient who is getting down from some vehicle or has come by any means to the hospital has to get the stretcher from there.
So today people are saying there are no more hospital beds. The city is full with all of the dengue. Is the crisis that bad?
Look, I would say that there is more of panic rather than actual situation being so bad. I would say that dengue is a viral illness that we all know. And like any other viral illnesses, it is a self-limiting disease, and 99% of the patients do not require hospitalization. Only because the name dengue has been given and there is a lot of media publicity, that is why there is a scare in the minds of people.
But there are hospital beds available.
There are, we have to create beds, even if not available.
Now just to tell our viewers outside, in the capital, 5 private hospitals have now got a notice for not complying, and after these 2 children have died. So, Dr. Nangia, your hospital hasn't got a notice. It wasn't one of them. But I wanted to ask you, today the directions that have been given by the health minister, do you think you can follow them? That even if you don't have beds, you can't turn anyone away. Can you follow this?
Yeah, sure. I mean, not that we can turning away the patients at any cost anyway. So the protocol that we are following is, what we have to understand before that is that dengue is not every time it is not related with death. As Dr. Sharma also said, there's an overreaction to dengue right now in the city. It's just like any other viral illness, and probably if there were patients could even be managed at home, if their blood pressure is adequate, if the platelets are not falling too rapidly, if there's no bleeding from anywhere. First of all, I think what is important is to be able to triage and see which patient needs hospitalization and which does not. Every patient of dengue does not require hospitalization.
I understand, yes.
Dengue has its own 3 phases. First is the febrile phase, where the patient runs fever for 4 or 5 days.
But I'm saying, do you have beds available right now?
Right. So to answer that is what I was coming to. How do you make beds available? After all, there's a fixed number of beds that are available in any hospital. How do you make them available? Is by triaging the patient, prioritizing who requires hospitalization, who does not. Every patient of dengue does not require hospitalization, unless the patient has a comorbid illness like a diabetes, heart disease, kidney disease, or is very sick with falling platelet counts, bleeding from some side, excessive vomiting, not being able to take orally, severe abdominal pain, abdominal distension.
Continuously be assessing.
Exactly. Like this lady behind said that she took her friend to the hospital suspected of dengue, and just with pain, body aches, that's not something to be really worried about.
Was she admitted after that?
No, because
she wasn't admitted. She was sent back.
Just a pain in the body does not require admission.
Okay, but perhaps one of the things to mention is the fact that the young boy, Aman, 6-year-old boy who died, he was turned away from a government hospital. We don't have their representatives here, so we will not be mentioning their names. He was turned away. So perhaps, was that a case, Dr. Nangia, would you say, that maybe the triage prioritizing went wrong?
See, I am not aware of the details of the case.
Of course.
But we have to understand that first 4 days of the illness, nothing happens to the patient.
Yeah.
It usually happens from the 5th to the 7th day when the complications occur. That is the time where we need to see whether the patient requires hospitalization or not.
Okay.
But just a high-grade fever is not, and a dengue test positive, is not an indication for hospitalization.
Okay. Now we are also joined by Dr. Rajiv Sood. He is a member of the Indian Medical Council, and just to point out that the Indian Medical Council is the body across the country, the top body across the country, which can actually debar a doctor, take away their license, right, doctor? Now the 2 little boys who died because they were turned away. Dr. Sood, is the Indian Medical Council taking any action against those doctors or that hospital?
See, there is the Ethic Committee in Medical Council of India, and in the Ethic Committee the issue is always discussed. When these issues are either published in the newspapers or they are reported. So that Ethic Committee will be taking care of this, and the findings, whatever findings are coming, accordingly the action will be taken.
And when was the last time you heard? We've already heard notices, Mr. Mittal, notices being sent out to these hospitals. What kind of action can we expect? We know that you have dealt with many clients who allege medical negligence. Here, the government has taken notice.
See, when the clients allege medical negligence, they pay money for it, so therefore they come within the definition of consumer. So they have a right to go to consumer courts for that. But here is a different case altogether. Now, when we look at negligence, we'll have to look at two aspects. One is whether it's criminal negligence or it's civil negligence, as in law of torts you can claim damages, compensation, etc. and all that. But the law as stands in criminal prosecution, I don't think this refusal to give treatment really will be amounting to a criminal act. In fact, I must also inform you that the 1989 Supreme Court expresses concern on these kind of things which are happening in these hospitals.
But what happened with these two little boys, is that criminal case or not?
Well, that's what I was answering. In 2006, the Law Commission had recommended that a law be framed where if the patient is refused in cases of emergency treatment, the person should be punished, that is the medical hospital or the medical practitioner can be punished up to 6 months. And recommended to the state governments, because hospital is a state subject, that they should enact such law. But as on today, such law has not come in. So therefore 304A, the extent of involvement which is required for the purpose of holding you liable for criminal negligence may not really apply in these cases, really at this stage at least I can say.